Go ahead.
Good morning once again. My name is Petronella from the Zambian Hub. So before I make my comment, just a quick show of hands. How many of us in here, when we have a crush, when we meet someone, do we sit down and say, are we going to use condoms? Are we going to use PrEP? How many of us have ever done that with someone we've liked or been in a relationship with? Has anybody in this room ever met someone they liked or they're in a relationship with and they've sat down and said, we'll use condoms because of ABC or we'll use PrEP as a method of protection? How many of us in here? Yes, in a relationship, a crush, someone you want to have sex with, how many of us have ever sat down? Right? So it's a very uncomfortable conversation to have with someone that you like, to sit down and say, these are the preventive measures that we can use. So my point is that we're talking about PrEP, and it's one of the preventive measures that we can use. And to borrow from your term, you did say that PrEP is not just a user-controlled HIV prevention, but it's highly dependent on the complexities of social fabrics. So what I'm trying to drive at is that I think in our programming, it's very important for us to start putting in relationship skills, because at the end of the day, these relationship skills will, if comprehensively put together, can address issues of substance abuse, stigma and discrimination, and IPV that I've seen that is very apparent in a lot of studies. So I really think that going forward in our programming, it's really important for us to start including relationship skills as a part of a way we can curb HIV prevention in young people. Thank you so much.
Wow, thank you. Do you want to comment or go to the next question? Next question.
Thank you very much, Ford from Zambia. So she outlined, sorry, I've forgotten your name. Okay, yes, Madam Constance outlined some of the challenges in line with PrEP, as in some of the young people are being maybe stopped from taking PrEP because of different reasons, and mostly it's from parents. They've been told, why are you taking PrEP? What's the reason what's the reason you're taking PrEP? Yeah, so most of our young people have different reasons in which they want to take PrEP. Some it's not only through sex, some it's through maybe they've been, they know to say, okay, I'm going to be doing this, so I might be exposed. So that's why they're taking PrEP. So my question is, from what I've heard, that so many young people are having these barriers to taking PrEP. So what are we going to do to help us young people so that we understand better what PrEP is? Because when you look at it, in our communities, let's not hide from the fact that most of our community members, especially young people, don't know much about PrEP, what PrEP is, how it works. The only thing they know is that PrEP is an ARV drug. They take it as it, people have to take it, those who are on ART, those who are HIV positive, but that's not the case. It's just a preventive measure for HIV. So what measures are we putting in place to help young people out there get the information they need to know about what PrEP is, even our parents, because they're the key stakeholders. Thank you very much.
More of researchers than program implementers, but what we feel needs to be done is there has to be dialogue. We have to put the word peace at the top, and we have to remember that these adolescent girls and young women do not live in isolation of the community itself. So dialogue has to start community level, adolescent girls and young women, the healthcare system itself, and say how best can we help them so that they are protected. Because we cannot continue burying our heads in the sand and say things are okay when they are not okay. Things have happened. What's the way forward? Let's have proper discussion. Let's have youth-friendly corners, or some were suggesting, at these health facilities, can we have youth nurses, not like a mother-looking kind of a nurse sitting at the end of the desk? We want somebody who understands what I'm going through, not somebody who thinks they have to tell me what I need to do when I've done it already. I can't tell her I've done it already. Please give me somebody that I relate with. So those are some of the proposals that we are putting across to government and all these organizations. Thank you.
Just to add something quickly around relationship building and linking it to communities, I think we just have to be careful that we're not expecting the young person to do all the work. So let's do that. We all could use help in talking to our partners and negotiating. And no one more than young people who are just also doing, sometimes it's your first relationship. It's very normal to need help. A lot of the gender norms that we are mentioning, though, also require community work. And I think what Constance mentioned in terms of these platforms bringing together, we do have methods, community conversations, there are other approaches to do this in the implementation space, not necessarily in the research space, but sometimes in both. So, and to acknowledge that it will be hard work. These are very difficult conversations. Over.
One more question, and then we need to go to our panels where we're going to discuss more of this idea in detail. Over there.
Thank you so much. My name is Emmanuel Chilongo from Tabene Youth Advocacy Network in Zambia. So mostly, I don't know if it's a concern or a question, but I'll mix them both. Looking at the presentation from Madam Constance concerning the PrEP on adolescent girls and young women. Now, we know to say it's quite difficult. It's easy to access PrEP than to maintain it. It's just the same with people that are living with HIV. And looking at these young people who are HIV negative, most what comes in mind when you start PrEP is that if people find out you are taking PrEP, they will say you are also HIV positive, which is making it difficult to maintain on being on PrEP. Most of these young people want to be on PrEP, but to maintain it is because the influence and the environment that we are associating it's what makes it be difficult. And you find that most of these people can be enrolled in PrEP and initiated, but they will just going to pack the medication, and others they will throw it away. We have seen, I myself who has been living with HIV for the past 16 years, I can testify to say adherence is not something that is easy. And when to somebody who is not HIV positive and taking PrEP daily, it's more like you're just also living a positive life, which is very difficult. So we have to put some measures, and the most mistakes that we make is that we are doing most of the intervention at the healthy facilities, but we are forgetting that everything starts in the community. We need more engagement from the communities. If we want to have a lot of young people be put on PrEP for HIV prevention, we need face the community. We need parents and guardians and young people. Thank you so much.
Well, now I would like to hear a last round of applause for our amazing presenters. And thank you so much. I'd like you to excuse. And now I would like to invite my fellow panelists or chatelists who will come and join me for a conversation about really concrete ideas on how we overcome the issues. First, I'd like to present you to my dear colleague, Annah Sango. She's from Zimbabwe, and she's an advocacy officer for the Ending Pediatrics AIDS on Children program, EPIC, at the Global Network of People Living with HIV. The gorgeous Lyle Mans. He's from the Netherlands, where he works as a lobbyist for AIDS funds. He's also a long-time SRHR youth activist, and now he's a candidate for the next parliament elections in the Netherlands. So the Dutch in the house. Vote for him. My dear co-chair, Agatha Dafarel. She's from Indonesia. My fellow co-chair for this session and the program manager at Intimutan, Indonesia. And last but not least, our dear Lupa Kisio Robert Bukuku. Lupa. He's from the network of young people living with HIV in Tanzania. He's also a member of AfroCab and of the Unitate Communities Delegation. And he's also a clinician by profession and abstract writer. Chic. Okay, thank you so much for joining me here today. And we heard a bit more detailed framing of the issues around gender, sexuality, stigma that continue to impose barriers on the fulfillment for sexual health and well-being among young people and young people living with HIV. So now I'd like you to ask a few questions, because you as activists, program implementers, lobbyists, you have personal experiences, but also concrete ideas to inspire the implementers, the funders, the pharma industry in the room about how to implement concrete action for overcoming the issues we just heard here. So I'd like to start with Anna, since our last presentation was about young women living with HIV, and we heard a lot from Constance about the sexuality stigmas on adolescent girls' sexuality. I'd like to hear from you. What kind of interventions could minimize the effect of community stigma on sexuality and lead girls to empower themselves, protect and care for themselves?
Great, thank you so much, Aline, and thank you to the presenters. I think they did a very wonderful job in terms of explaining some of the challenges, and also from the floor, there were really a lot of recommendations around what can be done. So yeah, maybe first let me just do a round check. How many understand what sex is all about, or what sex is?
Sometimes I'm a bit confused.
Okay. All right, interesting. How many have had sex in the last month?
I know. Last night.
Okay, people are not having sex, I'm worried.
Is it last night?
Last month.
Oh, last
but
month.
yeah, yes, but it's interesting because I'm thinking within the room we have like a diverse group of people in terms of age, in terms of gender, and then also we're even kind of not sure about sex and really not even open about maybe acknowledging if we had sex last month or whenever, but probably it did happen, right? So here we are talking about adolescent girls and young women, right, who are in the context of maybe living with HIV, maybe identifying as, you know, a lesbian or trans, you know, and also dealing with the issue of having to take treatment, but also then dealing with the issue of the community, judging them for being horny, which is normal, right? I mean, we all get that. We all feel that, right?
Yes.
And they are in these communities, like Constance said, they are in the church, they are in the community, they are in school. So you find that it's a lot of challenges, it's a lot of issues for them to really have the agency. And as a community, we're also not doing so much in terms of safeguarding or supporting these young women and these adolescent girls. So you ask a question, Aline, around how do we minimize community stigma? How do we try and help these adolescent girls navigate through life, navigate through sex, navigate through relationships? Someone talked about relationship. I think really it's about creating an environment that they can be able to speak boldly about sex, give them the necessary tools, empower them to be able to understand what their bodies are all about. And it starts from probably even at family level. I mean, I remember when I started menstruating and when I talked about it at home, and probably that was the first encounter of a sexual conversation with my parents was, don't smile at boys, you'll get pregnant. And then I didn't understand that. But it never went as deep as saying, okay, so now that you're a semi-woman, okay, and then if you have sex and if you have unprotected sex, you probably might get pregnant. You see? So those conversations don't go as deep as that. And that's where the community comes in, because the family is in the community. Constance talked about the church. Young people, adolescent girls are having sex in the church. But the church has been made into an environment whereby you only talk about sex when you're planning on getting married, when you bring your partner to your pastor, and then you start talking about sex. Why don't we use those as entry points to talk about sexual health, to talk about also access to prevention tools and commodities for HIV within that space? So I really think it's about looking at what is there in the community right now. I know at some point in the past 2 days we talked about culture, and we talked about how dynamic culture is. And we also know how difficult it is to infiltrate culture, because it's there. It won't go away. But how do we utilize certain entry points within culture that can navigate us into talking about sex, into sharing positive messaging around sex? Let boys and girls understand their bodies, know how their bodies work, know that it's okay to have wet dreams, know that it's okay to feel this, it's okay to do that, and then help them understand the how or the what they need to do when that happens. So I don't know if I've answered your question entirely, but yeah.
Thank you. The community and cultural entry points are great ideas. And Anna, just a quick follow-up question. If it's hard for us as adolescent girls to navigate sexuality, I imagine that it must be very challenging for adolescent girl living with HIV, starting to feel horny, and having to navigate the HIV and sexuality double stigma. So for them, how do you advise us to create an empowering environment?
So I'll still go back to also community and facilitators. I think there's really need to ensure that we have a comprehensive package for adolescent girls and young women. All their lives, because they are on art, so all their lives they're going to be engaging with a health facility at one point or the other. If not all the time, they're going to be engaging with peers and also within peer-led interventions. So I think it's good to make sure that the peer-led supporters are equipped to be able to assess their peers as well, to deliver the correct and consistent information, to be able to guide them in terms of accessing treatment and also being able to access prevention methods. From the floor, I think someone spoke about, taking PrEP and then also relating it to having to take antiretrovirals every day, the pill burden, the fatigue. We all know that, the depression that is associated with that. So I feel like the comprehensive package really needs to look into all those issues, really needs to address mental health issues, really needs to address the depression issues, so that this adolescent, this young woman living with HIV is within a mental state that they can fully access services, and then they can do away with fear, because we know as long as you fear something, it becomes difficult for you to fully access the care that you need if you're afraid. But if the environments are made in a way whereby I'm not afraid to talk to either my peer, I'm not afraid to talk to a youth looking nurse, not a motherly looking nurse like what Constance said, but also I am empowered enough to have the agency to be proactive when it comes to my health and well-being.
Yes, and to be able to enjoy pleasure as well, right? This is a key part of sexual health. And I would like to hear from my colleague Lupa about a very other important side of the equation, right? Which is engaging adolescent boys and young men, right? So do you have any ideas about how we could help to challenge toxic masculinity that creates risk behaviors that leads to more infections and gender-based violence?
Okay. First, we all understand that the young boys are using this toxic masculinity as the defensive mechanism, and this is influenced by the culture and the social norms in our community. But this tends to turn into a negative trait, because it translates to many forms of gender violences. Also, unfortunately, this toxic masculinity has been an uncomfortable conversation in our community, so we do not address it in public spaces. So the question is, how will we address this topic in the diversity of the genders?
Firstly, I think we should integrate the foundation school curriculums that will, since at the foundation at the early ages, which will include the studies which will include the comprehensive sexual education that will able to elaborate issues concerning gender equalities as well as the harm stereotypes scope. Also, I like to advise about the imbalance of patriarchal and matrilineal system. This imbalance tends to pairing to create this toxic masculinity. But also, I would like to encourage the open dialogues in our communities about all issues concerning toxic masculinity and their negative impacts in the community.
Thank you. And for reminding us that toxic masculinity is a performance that is repeated and it's inspired by our parents, by our community. Now I'd like you to wear your Afro-cab hat because we talked about pill fatigue and the difficulty to adhere to PrEP even after you access it, right? What are some of the actions that need to be taken to ensure that there is an increased uptake of PrEP among girls, but also among young key population, given some of the issues that were raised here?
Okay. First of all, we understand that the use of the oral PrEPs to young women and the young population, it has been a problem because it creates various types of stigma on them. So, but we have these modern technologies, the long-actings. So, for what I think now, we should promote or we should create a form whereby the young women, the adolescents could have variety of options of these PrEPs. For example, they can use the pills for those who are comfortable with it, and those who are not comfortable with it, they can use the injection. And also, the studies show that the other technologies are coming, such as the implants and the antibodies. But there is a challenge and the problem. How will this new technology be accessible in low and middle income countries? I know the VIVs are here. Yeah. Also, now we call upon to them, the drug manufacturers like VIV and JJ, to early distribute the patents so as the generic manufacturers can produce this drug, which will help this drug to be accessible at affordable prices. I think that's all. Thanks.
Do you want to add anything about choice?
I do. I think the importance of choosing something is that it gives young people the driver's seat. So I think like since the first day we've talked about the importance of putting young people in the driver's seat, right? And I think it's not limited to only those who are programmatic, but it's also important to ensure that all young people are in the driver's seat to choose the best intervention for their health in any context, but in this context for HIV and SRH health. Because when you want to give someone a choice, you're already wrong because you don't get to give someone a choice. You were never given the power. The power will always theirs by default. Thank you.
Agatha, and I'd like to come back to you about an issue that was a very hot topic in this conference, which is about parental consent for accessing SRHR services. I'd like you to talk from the point of view of adolescent key population, right? Transgender girl. Does it work for young key population, parental consent? And if yes or no, why?
Okay, thank you. The answer is no. I rest my case. No, because listen, here's the thing. Who in this room felt that when they are growing up, the parents aren't the safe people to go to? Who felt that their parents are not the safe people to go to? Well, are not safe people. Wow, a lot of you have wonderful parents. Thank God. Thank you so much. So, listen, in Indonesia, 71% of violence were happened inside the home, the house. The call were always from inside of the house. Can you imagine, like, the house, the home, that are supposed to be the safe space for young people to go home to sleep, to be loved, are actually the safe place for them to even be themselves. And this will link to another fact that, sadly, 120% young LGBT people have higher risk of experiencing homelessness. This is because of either they're getting kicked out or they run away from their homes. And the numbers are even higher in the transgender women. Like in Indonesia, a lot of transgender women have to run away from the home, for the hometown, because it wasn't necessarily the safest place for them to express themselves. So then they ran to the bigger city, usually the capital city of Indonesia, Jakarta, and they engage in sex work when they aren't even 17-year-old. But then, because of the risks of, contacting HIV, they have to get tested, right? But because of the parental consent, they weren't able to get tested. Because of course, at the end of the day, it's parents' choice, darling. So is it effective? And is it answering the problem if we resort the case all to the parental consents for adolescents, key populations, to access the HIV test? I would say no, because parents, most, if not all, most parents are not humans.
Well, I think this is also opens the case for us to engage the parents, but also to help them to challenge their social stigmas and prejudice. Of course, there are avenues to work with parents, but very important that you highlighted that first point of care. If we rely on that, it may not work for adolescents in their diversity. Thank you so much, Agatha. And now, Lyle, I'd like to ask you, based on your experience of accessing sexuality education and on your activism as well, what are the aspects of CSE that need to change to challenge self-stigma, mainly among young key populations, and to promote well-being among them?
Yeah, thank you, Aline. I can maybe answer your question also from a personal experience. So when I was in high school, I was a gay man, and I was looking for information on how to protect my sexual health. Actually, at the age of 18, I also started to do sex work in the Netherlands, to enable for me to pay for my travels, to be able to learn languages, and to pay for my studies. So obviously, I was in dire need of good information that would enable me to protect my sexual health. And back then I was in high school in Belgium. We actually got sexuality education from a biology teacher who did not really like to talk about sex so much. And there were two problems with what she said. First of all, when it came to gay sex, she only mentioned it once, and she said, do not do it. And the second thing was, in terms of risks, that was the only thing that they could talk about. So what consequence did this have in me and the classroom and also in my peers? In terms of the risks, everybody started to become afraid of sex. It did not mean that they were not going to have sex. They had as much sex as they would have had with a different approach, but it was only focused on fear. And we know that when fear is not a good motivator to protect your sexual health. So the other issue with me was that my teacher basically was telling me, you cannot talk to me about being gay, because she said that I should not have gay sex. And it meant that the first time I had sex with my boyfriend, we actually wanted to use a condom, but the condom broke because we did not use any lube. So we did not have the good information on how to properly protect ourselves. So what does this teach us about sexuality education? And I think many people are struggling to have these conversations in the classroom. First of all, it's good to have sexuality education in the classroom. At least it led me to using the condom, so that's something. But it needs to be stigma-free, and it needs to be a broader conversation than only about risks. And sometimes we are not so comfortable to talk with our teachers about sex, and sometimes our teachers are not so comfortable to talk about sex with us. So we can also look at other options. Do we get peer educators inside who have been trained to open this conversation in a more stigma-free way? Or do we have to train the teachers to make them more comfortable to engage in these conversations? So there's different ways how to do this. But we also have to think about outside of the classroom. For me, what has been a great help were community health centers. We had the Amsterdam Center of Sex Work, and it was the first time that I could have a stigma-free conversation about me being a sex worker and being able to get the information that I needed. Because these nurses were specialized, they knew the community, and they were trained to be able to create trust. So these community centers are extremely important. And then also peer support groups. When later I got diagnosed with my HIV, I was really, really sad. And maybe if you're sad, it's not the best place to be adherent. So for me, a way to learn to accept myself was go to the association of people living with HIV, have peer support groups, and that gave me the strength to overcome my fears, to overcome my sadness, and to start taking care of myself. So what we need is reliable education, peer support, and reliable information that is stigma-free. And I think if we do these things, we can make great changes.
Thank you for reminding me of the clinic in Amsterdam. I accessed it as well as a sex worker, and the great thing about there is that they respect your privacy. You don't need to give your real name, just your war name and the phone number, and that's it. Yes, thank you so much. And now, we don't have time for questions, right? Okay, so I will ask my panelists to close this panel by saying in one phrase, what does sexual health and well-being mean to you? Start with Lupa.
For me, it's like the state of being physical, emotional, and social fit in relationship to the sexual experiences in relationships. That's what I meant.
For me, it means sex that is fun, sex that's based on consent, and where you give pleasure to each other, and where you are also, of course, protecting your health. Yeah.
For me, it's informed, consensual, safe, and pleasurable, definitely. Yes.
As a 21-year-old transgender woman, born in a very strict conservative Muslim family, I would say it's everything, because I need pleasure.
For me, is a sex that doesn't put me in danger of being criminalized, is stigmatized, and of course, sex that is delicious. Thank you so much. A last round of applause for our panelists. And I hope this inspires you to have conversations about safe, empowering, and delicious sex in the rest of the day.